Okay, I'm gonna scan my room. Okay, first I'm gonna verify orders and hospital policy, and then verify the patient's identity using the patient's armband. I have Jaguar Jones, date of birth 8/25/63, 8/25/63, medical record number 417-417-6352, 6352, and also verify the patient's allergies using the chart and the allergy band. I have allergies penicillin, Next, I would explain the procedure to the patient and pull the curtain to provide privacy. I've already gathered my supplies. I'm going to be using a Salem sump tube, and I already have my tape prepared. I have one that I dog-eared, and it's on my tubing already that I used in my video with my volunteer. And I have my other 2 pieces of tape, and then my piece of tape to secure the NG tube to the patient's nose. So the next thing that I would do is don my, also normally I would have a 60 milliliter syringe, a tongue blade, and a pulse oximeter. So I'm gonna don my goggles, and then I would perform hand hygiene. I would raise the bed to a working height, I would lower the side rail, and then I would assess the patient's vital signs. I would place the pulse oximeter on the patient's finger, and I would remove the linen and the gown from the patient's abdomen and use my stethoscope to listen to the patient's bowel sounds. If there's a decrease in oxygen saturation or other deterioration of vital signs, then the NG tube insertion should be stopped until patient stability could be determined. I would then elevate the head of the bed to high Fowler's position unless contraindicated. And next, I would open my NG tube package, and then I would place a dollop of water-soluble lubricant on the tube. As I stated, I already have my tape prepared. If I had a 60 milliliter syringe, I would loosen the plunger on it. Then I would perform hand hygiene and don my gloves. Next, I would assess and select the patent nair by having the patient occlude one nair and breathe, and then occlude the other nair and breathe. And then I would clean the bridge of the patient's nose with soap and water or either an alcohol pad, and I would pat the nose dry. So, Mr. Jones, if at any point throughout the procedure you need me to stop, I want you to just wave your hand for me, okay? I would also have the towel and the large basin over the patient's abdomen. I would lubricate the first 4 inches of my NG tube. Alright, Mr. Jones, I need you to lean your head back for me, and I want you to breathe through your mouth throughout the procedure, okay? Okay, I'm past the nasopharynx, so Mr. Jones, I need you to relax and lift your head forward for me. If allowed, I would have the patient sip on water or either dry swallow and advance the tubing 1 to 2 inches while rotating 180 degrees. I would not push or force against resistance. If the patient begins to cough, or if there's a decrease in oxygen saturation or other signs of respiratory distress, I would pull the tubing back into the posterior nasopharynx and allow for normal breathing to continue. And I would have the patient swallow again before beginning to advance the tubing. Next, I would secure the NG tube to the side of the patient's cheek for a temporary securement. I'm gonna take mine over here. I'm gonna move this out of the way. And then I would use my pen light, and if I had a tongue blade, and I would look into the back of the patient's throat to see the placement of the NG tube. Next, if I had a 60 milliliter syringe, I would connect it to the tubing, and it would go here. To check the correct placement of the tubing, I would aspirate the gastric contents and check the pH, or either I would, if there was an x-ray ordered, I would have the x-ray performed on the patient. So next I would prepare the bridge of the patient's nose with a skin prep pad, and I would use this piece of tape right here and place it on the bridge of the patient's nose and on the NG tube. This allows for the NG tube to float, so there is no pressure on the patient's nares. I would also mark the exit side of the NG tube. This is for a guide for any displacement of the tube, and also for my other piece of tape, I would write the date and time on it and place it on the bridge of the patient's nose. And I would then I would remove this piece of tape and also remove this piece of tape. And then I would, if there was suctioning ordered for the patient, this is how it would be connected. Into here with the blue pigtail above the patient's stomach, and I would connect it to low wall intermittent suctioning. If suctioning was not ordered, then the tubing would be like this, still above the patient's stomach. And then I would lower the head of the bed to no lower than 30 degrees. I would lower the bed to the lowest position and raise the side rail. I would clean up my mess, and I would take off my gloves. I'm not going to do that because I'm going to use them in a minute. And I would perform hand hygiene. I would also ensure that the call light was within the patient's reach. And then I would document the size and type of NG tube, the location, whether it was in the left or right nare, the patient's response to the procedure. I would document if there was any secretions, the color, the amount, and the characteristics of the secretions. And I would document the time of the procedure, and that's it. And then if the NG tube, if there was an order for discontinuing the NG tube, of course I would again verify orders, hospital policy. I would verify the patient, the allergies. I would raise the bed to a working height, lower the side rail. I would raise the head of the bed to a high phallus position, and I would again explain the procedure to the patient, and then I would don my clean gloves. Next, I would assess the patient's bowel sounds again with my stethoscope. I would remove the tape from the patient's nose. I would remove the clip from the patient's gown, and then I would say, "Mr. Jones, I need you to take a deep breath for me and hold it." And then I would remove the tubing in one smooth like that. So then I would document any secretions, and I would perform oral care, and then I would perform documentation.